Roach, I'm the emergency nurse practitioner at Stanthorpe Hospital. I thought I'd just run you through the LifePak 15. So basically this machine is designed to monitor patients as well as to do some defibrillation of patients if required, and it can also pace patients. So it has some facility to do a 12-lead ECG as well as do blood pressure, invasive blood pressure and non-invasive blood pressure monitoring and end-tidal CO2 monitoring. But I thought we'd just keep it really simple today and just go through some of the buttons. So basically it has two sides to it. So it has a semi-automated capability as well as fully manual capability if you need to shock someone. So basically what you need to do is turn the on button, self-explanatory, and then these machines, and most of the machines come with some quick combo paddles, which are actually, you're able to monitor patients through these as well as defibrillate patients through these. So it's all hands-free now, which makes it really easy and it's safer. So I thought I might open these actually and show you how they attach. So they basically come pre-gelled, so there's no requirement for any gel with these paddles at all. They have on them where you need to locate, there's an adult one and there's a paediatric version of the quick combo. So these are used for patients who are older than 9. This one shows you to put it on the right upper chest area, and this one goes in the left mid-auxiliary line basically. So once they, you just peel off the plastic backing and you apply them in the position that it's set, and then you hook them onto the therapy cable, which only goes on one way, and then you're ready to monitor or to defibrillate the patient. As soon as you get them on, as soon as you plug them into this therapy cable, it basically goes straight to monitoring the patient through the paddles. Then in terms of if semi-automated mode, if you hit analyse, and I might just put it on the simulator so that you can see. So we've applied the paddles to the patient and we've got a rhythm, and now we can tell the machine to analyse the rhythm. If you're not sure, this is semi-automated mode, so you press analyse.
Analysing now. Stand clear.
So even if you're doing CPR...
No shock advised. Start CPR.
So it tells you, it has a metronome, one that's for when you're doing compressions, and it will tell you when to ventilate the patient. Soon.
3, 2, 1. Ventilate. Ventilate.
So if at any time, so the rhythm's changed, but the machine doesn't actually interpret that rhythm change, but if you notice that there was something different, you could ask the machine to reanalyse.
Analysing now. Stand clear.
Which it does for you.
Shock advised.
The machine automatically charges to the right amount of
Stand clear.
joules.
Push shock button.
And then it's just a matter of pushing the big orange button that says to shock the patient after you've done all your safety checks. And it produces a printout.
Start CPR.
So it's in semi-automated, it tells you exactly what to do, basically. I'll put it back inside so it's not going to alarm us. And the other option is if you felt confident and competent and you recognised that there was a shockable rhythm and you wanted to shock someone, then you proceed down this side of the LifePak, which tells you how much energy would you like to select. You have to manually charge the machine, and then you have to manually deliver the shock. So that's basically how you would defibrillate someone. The next step that we can talk about is how to pace someone. So you've got someone who has pretty yucky looking rhythm. The machine it's pretty basic on how to do this. It's not hard to do. So there's a pacing section, or the green button. So you tell it to pace. You dial up what rate you want and you adjust it by pressing these buttons, and then you adjust it till it captures the rhythm and starts pacing. So it's basically, so if we start at low milliamps, and you can see that it has been delivered, but it's not capturing with the QRS, so you keep turning it up until it captures with the QRS and increases the heart rate accordingly to what we've set, which was 60. So if we dial it. So there we go. So we can see that it's pacing, the electricity is delivered with the QRS at the start of each QRS. And that's basically all that there is to pacing.
Okay.
Okay, so if we just go back to basic monitoring now of our patient. So the screen can be manipulated by using the selector knob. So you twist it to wherever you want on the screen, and then if you push it in and select it, you can change the alarms, you can change whether you have a volume with each heartbeat, all of those kinds of things. So that's just a matter of playing around with and adjusting it to what you want it to be. And then the other thing is that down lower, you can see that that's blood pressure. So what you basically do is highlight it, you press select, and then the cuff will inflate and you'll get a blood pressure that's recorded. From there, you can also set intervals so you can have it to regularly go off in 5-minute intervals if required to check someone's blood pressure. On the other side of it, so as I was saying before, we have end-tidal CO2 monitoring, and that's an inline monitoring. So basically for ventilated patients, you put it in between the ET tube and bring it back to the life pack, and it will deliver a value for end-tidal CO2 monitoring with a waveform. The SATS monitor, it's like any other SATS monitor, it basically just goes onto the finger and it will deliver a trace, as well as giving a numeric value. And then there's a pressure 1 and pressure 2, and that's for invasive blood pressure monitoring, so arterial line monitoring, and you get a waveform with that as well. The waveforms for each of those different measurements that I was telling you about will show up lower than the cardiac tracing. And you have a patient connected and you have all the leads on, so you can obtain a 12-lead ECG. And the good thing about this machine is you can also print a code summary which will give you details of the patient's observations, the treatment that the patient received. If you have enough staff, you can be technical enough to dial in that the patient had adrenaline at such a time, and it will print out in just one big statement for you. But if you have the luxury to have that amount of staff, generally you're not going to be using a code summary, I don't think. And a print is if you just want to print. If you notice there was something abnormal on the cardiac monitor, you could just hit print quickly, and that would show you some of the waveform from there, the ECG tracing. These are the new machines that they're going to use for transport in the retrieval services and the ambulance are going to use. So it's designed to be pretty tough and hardy, and it's also got some good battery capacity, and it's pretty self-contained with everything in it.